The story of the COVID-19 pandemic begins in Wuhan, China, a bustling city known for its industry and culture. In December 2019, doctors noticed unusual pneumonia cases. Patients had high fevers, persistent coughs, and difficulty breathing. The illness spread quickly and its source was unknown. Scientists soon identified a novel coronavirus, SARS-CoV-2. The virus overwhelmed Wuhan's healthcare system. The world watched with concern as Wuhan made headlines. Chinese authorities placed Wuhan under strict lockdown. Despite China's efforts to contain the virus within its borders, COVID-19 had already begun its journey around the globe. Travelers from Wuhan unknowingly carried the virus to other countries, seeding outbreaks in new locations. By January 2020, cases were reported in Thailand, Japan, South Korea, and the United States. The World Health Organization, tasked with monitoring and responding to global health emergencies, recognized the severity of the situation. On January 30th, 2020, the WHO declared the COVID-19 outbreak a public health emergency of international concern, a designation reserved for extraordinary events that pose a serious risk to global health. As the virus continued to spread, fear and uncertainty gripped nations worldwide. Countries scrambled to implement measures to protect their citizens, borders were closed, travel restrictions were imposed, and people were advised to avoid large gatherings. The pandemic disrupted daily life as we knew it. Schools and universities transitioned to online learning, businesses implemented work-from-home policies, and many industries faced unprecedented challenges. The world was in uncharted territory, facing a threat unlike any it had seen in modern history. With the virus spreading rapidly, governments implemented measures to slow COVID-19 transmission. Lockdowns involved stay-at-home orders and the closure of non-essential businesses. Mask mandates were widely adopted to prevent the spread of respiratory droplets. Public health campaigns emphasized hand-washing, social distancing, and respiratory etiquette. Testing became crucial to identify infected individuals and trace contacts. Healthcare workers made immense sacrifices on the front lines. Section 4, the economic earthquake, job losses and market crashes. The COVID-19 pandemic triggered a global economic crisis unlike any seen in decades. Lockdowns and restrictions forced businesses to shut down, leading to widespread job losses and economic hardship. The travel, tourism and hospitality industries were hit particularly hard as borders closed and people stayed home. Global supply chains were disrupted as factories shut down and transportation networks faced challenges. The demand for goods and services plummeted as consumers cut back on spending amidst the uncertainty. Stock markets around the world experienced sharp declines as investors reacted to the economic fallout. Governments responded to the economic crisis with unprecedented measures. They implemented stimulus packages, providing financial assistance to individuals and businesses struggling to stay afloat. Central banks lowered interest rates to encourage borrowing and spending. The economic impact of the pandemic was felt most acutely by vulnerable populations. Low-wage workers, those in the informal economy and marginalized communities, faced disproportionate job losses and financial insecurity. The pandemic exacerbated existing inequalities, highlighting the need for more robust social safety nets. Section 5. A beacon of hope, vaccines emerge. As the world grappled with the devastating effects of the pandemic, a glimmer of hope emerged from the scientific community. Scientists around the world worked at an unprecedented pace to develop vaccines that could protect against COVID-19. Their efforts culminated in a remarkable achievement: the development of several effective vaccines in record time. Pfizer-BioNTech and Moderna, both utilizing innovative mRNA technology, were among the first vaccines to receive emergency authorization. These vaccines, shown to be highly effective in preventing severe illness, hospitalization, and death from COVID-19, marked a turning point in the fight against the pandemic. The rollout of vaccines began in late 2020, prioritizing healthcare workers, essential workers, and vulnerable populations. As manufacturing ramped up, more people became eligible for vaccination. Mass vaccination sites were established and healthcare providers administered millions of doses. The development and distribution of vaccines represented a triumph of scientific ingenuity and global collaboration. The speed at which these vaccines were developed and deployed was unprecedented, offering hope that the world could eventually gain control over the pandemic.